As a proud Army veteran, integrity and truth are the defining values that shape our military. As certified registered nurse anesthetists, also known as CRNAs, we embrace and incorporate science and evidence to guide our practice. Having served in the military myself, I care deeply about my fellow veterans and take seriously my responsibility to tell the truth. As president of the American Association of Nurse Anesthetists, I want to reassure veterans and the public concerning the safe care given throughout the country by certified registered nurse anesthetists. Evidence has continually shown that CRNAs provide the highest quality of care, regardless of practice settings or patient's health status. Did you know nurses are the most trusted occupation? For 18 consecutive years, we have been highlighted and acknowledged for our integrity and honesty. We combine science, evidence, and compassion. Nurses put their patients first by coordinating care in a complex healthcare system. We cannot allow negative and inaccurate statements about CRNAs to instill unwarranted fear. Our veterans and the public demand the truth. Politics and protection of outdated, redundant anesthesia staffing models are unacceptable when our veterans urgently need care. Did you know CRNA education is extensive and rigorous? Before focusing on an anesthesia specialty, CRNAs spend approximately 6,240 hours, about 3 years, at the bedside of critically ill patients. Once in a nurse anesthesiology school, the average CRNA completes approximately 8,636 hours, providing direct anesthesia patient care. This translates to, on average, 8.5 years of education and training before becoming a CRNA. I look forward to 2025 when all nurse anesthesiology graduates will earn doctoral degrees. Did you know CRNAs are the sole anesthesia providers on forward surgical teams and the predominant anesthesia providers in rural areas? Our training is why CRNAs are capable of stepping to the front lines during the current COVID-19 crisis. During this crisis, federal and state policymakers recognized our abilities and removed outdated barriers to our practice to meet the emergency preparedness for our country. CRNAs saved American lives. Here is the truth. The scientific evidence shows that CRNAs who work independently are safe. A 2010 study in Health Affairs, a peer-reviewed scientific journal, showed that anesthesia safety in states that had opted out of the Medicare supervision requirement provided the same quality of care as those that hadn't, showing that supervision provides no added safety benefit. Supervision is a redundant, expensive, and antiquated regulation. Accurate reporting builds credibility. The 2016 VA final rule explicitly stated that CRNA safety is not a concern. They were very clear to state VA's position to not include the CRNAs in this final rule does not stem from the CRNA's inability to practice to the full extent of their professional competence. Recognizing the value of truth and honesty, the VA went further, calling others counterproductive efforts on this rule not substantive in nature and akin to votes in a ballot box. Truth and evidence shines a light on CRNA safety. Did you know over 24,000 CRNAs are the sole anesthesia providers throughout the country? As we've already noted, multiple science-based studies have shown that CRNAs practicing independently are as safe as our physician anesthesia colleagues. We collaborate with the surgical team and across the healthcare spectrum. With CRNAs providing anesthesia care on the front lines for our armed forces since the Civil War, evidence has shown that CRNAs are able to handle the toughest cases in the most critical and difficult settings. CRNAs use their knowledge, critical thinking, and specialized skills in all settings, including in combat zones. Do you know the safest and most economically efficient anesthesia delivery model? The answer is the proven CRNA-only anesthesia delivery model. The VA Inspector General's own data on provider shortfalls showed that out of 141 facilities surveyed for this report, 31 facilities reported staffing shortages in the area of anesthesiology, most frequently in the medical officer and nurse occupations. We saw that facilities such as the Denver VA were canceling procedures specifically due to lack of access to anesthesia. As the VA continues to problem solve for gaps in the delivery of healthcare services, CRNAs are a vital solution, increasing access to surgical services while decreasing cost. In reducing anesthesia delivery costs, these savings can be shifted to other areas, including much-needed mental health services. Every patient deserves safe, quality, compassionate anesthesia care. Our nation's veterans earned and deserve nothing less. The AANA supports our veterans and their right to available, affordable, safe anesthesia care. We are grateful for the support of many veteran service organizations such as AARP, the Air Force Sergeants Association, Iraq and Afghanistan Veterans of America, AMVETS, the Military Officers Association of America, the Paralyzed Veterans of America, Vote Vets, and the Reserve Officers Association. In addition, we are humbled that both the Bipartisan Commission on Care and the VA's own independent assessment support implementing full practice authority for CRNAs in the VA. As a proud veteran who has served this country and cares deeply about my fellow veterans, I urge you to contact your lawmakers to support full practice authority for CRNAs within the VA system. This overdue policy change will improve veterans' access to the highest quality, economically sensible anesthesia care. Thank you.